So the storytellers are intended to be short, TED-like talks that really tap into the best new examples, the best news stories we can find. And as I think you all know, we crowdsource these from our community. The folks you're going to see over the next 2 days, 3 storytellers were drawn from 75 applications that we got through the shared value community. And we're so excited to hear this year's storytellers. So if you please join me in welcoming, please give a very warm welcome to Asher Hasan from DoctHERS. Asher? Thank you.
Great. Okay, my mic is working. Good afternoon, everyone. It's always a dubious distinction to be the first to speak right after lunch because A, I have to keep you all awake, and B, but I am assuming that some of you have had the opportunity to take a bite out of the Big Apple, literally and figuratively. And some of you still have fire in your bellies from the sessions this morning, which I thought were really terrific. So let me find the retina blaster first. Here we go. Okay. For those of, let's see if we can, the real reason I gave up surgery. Okay. So let me introduce you to a remarkable young lady called Maria. The first time I met her was when she was 8 years old. And just to give you the context of this, she was a daughter of a maid who earned less than $3 a day in Pakistan. And when I first asked her, what do you want to become when you grow up? She said, I want to become an astronaut. And I was just really awestruck by the extent and the intensity of her ambition and our aspiration. Unfortunately for Maria, her world and her dreams came crashing down to earth when her father, an auto mechanic, ended up having, who had had many, many years of uncontrolled blood pressure, ended up having a massive stroke. Now, typical for somebody in his socioeconomic group, he was taken to the nearest public health facility, not diagnosed in time, not treated in time, and finally transferred to a private care facility, but by that time it was too late. And he ended up being a hemiplegic and essentially incapacitated for life. Now, the reason I'm sharing this story with you is because I wanted you to have an understanding of what the impact, the generational impact, a single medical event can have on the life trajectory of a group of kids in the developing world who are going to be your future, potentially your future customers. So, there are hundreds of millions of Marias and families like Marias in the developing world. There are 87 million of them in Pakistan alone. And many of them, essentially, are living on the edge, living life on the edge, highly vulnerable to catastrophic events. So this is the problem that we decided to attack or to address at Naya Jeevan, which means new life in Sanskrit, Urdu, and Hindi. And at Naya Jeevan, our model is fairly straightforward. What we do is we aggregate large groups of informal workers who can be formally or informally connected to corporate value chains. And what we do to them is we give them or enroll them in group health plans, group health and wellness plans, including life and disability insurance. Now, what's unique about these plans is, number one, they only cost $3 a day. Number two, 90% and sometimes even 100% of those costs are covered by corporations. Now, you might be wondering, why on earth would a corporation cover health insurance of a low-income worker or a small mom-and-pop shop at the very end of their value chain? And there are 4 compelling reasons. Number one, and this is quite true for many of these companies, it actually positively impacts their bottom line. So Unilever right now in Pakistan has enrolled over 4,000 distributors, including their field sales reps, contractual workers, into a pay-for-performance program in which essentially they can enroll into a multi-tiered award program in which their benefits increase commensurate with their performance. And in other words, Unilever's insurance contributions are titrated or benchmarked to performance. Another reason, corporate social responsibility. Many of you have spoken about this earlier, especially in the extractive industries, oil and gas. In Pakistan, they're legally responsible to contribute 2.5% of their profitability or reinvest that money in the health and wellness or welfare of the communities within which they do business. So it makes much more sense for them to strategically align the health and wellness of those communities with their core business and with business outputs. Number 3 is a long-term view. Many of the companies that we work with are FMCGs, fast-moving consumer good companies, and they understand that in order to lift all boats, the rising tide that they have to create has to include income generation and asset protection. And what more valuable asset to protect than the human body and life itself? And finally, and something which is not generally appreciated, many of these companies, by risk pooling and by amplifying the populations of low-income workers that are enrolled into their group health plans, significantly enlarge the insured pool, and in doing so diversify their own risk, which enables them to actually negotiate much better pricing with health insurance companies. And oftentimes, that discount or the pricing for their managers and executives, the savings more than offset the contributions that they make for their supply chains. At Naya Jeevan, we truly believe that prevention is better than cure. And so we have a tremendous emphasis, or place a tremendous emphasis, on providing preventive health and wellness services. And 2 of the most popular of those services are providing our members with 24/7 access to family doctors through mobile phone. And the second is to assign or to designate a dedicated health coach or health promoter who is responsible for navigating patients through the labyrinthine maze, which is the Pakistani private healthcare system. Now, as we scaled this program, our need for quality primary care physicians rose significantly, and especially female physicians, because culturally, many of the women in our country prefer to be seen by female doctors. And that actually led to a very unusual and unexpected discovery, which is that over 3/4 of licensed female doctors in Pakistan are not practicing medicine. They are actively excluded from the health workforce. When we first heard this statistic, we were really bewildered, and we really wanted to understand, hey, is this the tip of the iceberg? Or what lies underneath? And what might be the professional or socio-cultural barriers which are preventing them from working? And this is also an issue that was of intense personal interest to us, because 2 of my co-founders are doctors, female doctors, who actually had their careers truncated, medical careers and corporate careers, because of the need or the desire to raise families. In other words, their desire to raise a family was completely incompatible with the needs or the system or the health system that had not accommodated those needs. So what this led to is the creation of a new digital health venture called DoctHERS. Now, DoctHERS, our raison d'être, or our key mission, is to enable women, to connect women to their full potential. And we do this, especially female healthcare professionals, and we do this by linking female doctors who are home-based to remote communities or patients in need via nurse, community health worker, or midwife-assisted telemedicine. These intermediaries, the health workers, are equipped with tablets, cell phones, laptops, tablets, smartphones, and they are also equipped with something which is really essential, which is the trust of their local communities. That actually is the secret sauce, which is having that physical touch with the communities and the trust of the local communities. And we recognize that, in fact, it was this human touch and the sustainability and power of this human touch that would actually enable us to provide healthcare in remote communities like this, which is spectacularly beautiful but hugely underdeveloped and completely devoid of health resources. This is a part of northern Pakistan which is very popular with mountain trekkers. I encourage all of you to visit. Finally, I'm going to end with a quote from T.S. Eliot, who said, "We shall not cease from exploration, and the end of all our exploring will be to arrive where we started and to know the place for the first time." Now, when we started 8 years ago, we were very urban-centric. We were focused on urban slums. We had no conception or idea that we would actually be able to provide last-mile rural healthcare. And really, for us, it's become a discovery, and it's been really an interesting journey. And it's required what I call the passion, perseverance, but above all, partnerships, especially of those corporations that have extensive value chains who've partnered with us and enabled us to provide that last-mile rural healthcare. Earlier on in our inception, we felt that if we want to go fast, we have to go alone. But now we realize, many years later, that in order to go far, we must go together. Thank you.